So, Dr. John, it was a pleasure to have an interview with you. And let me firstly congratulate you and your company for this commendable work that you've been doing in 3D printing and 3D planning and designing. And I know that the way you actually started your journey has been really for people to know where you started. And let me congratulate you for this great effort. Let me start the first question, Dr. John. Uh, uh, you know, how do you think 3D printing can be a constituent for medical practice? Uh, I mean, medical practice when I'm saying for medical science, so it is taking care of a very large area of specialization. But starting with maxillofacial, doctor, if I may ask you, how do you think printing can be a constituent to this particular uh, specialization?
Thank you, Shibu. Thank you for the opportunity that for inviting me for this wonderful session, and thank you for the honor. You've always been a great support to young budding companies and young budding surgeons in the field of technology-assisted surgical services. So thank you very much. Yeah, if you look at see how 3D printing is going to be helpful as such is today technology is playing a very big role in healthcare. Okay, that's a fact which we all need to understand, and we need to embrace it, and we need to hook on to it. Now, if you look at this 5 years before, technology was already there. People used to, surgical skill. There's no challenge to skill. But what happens is our concept of us visualizing things, our concept of us seeing how the patient is going to be, predicting how the surgical outcome will be, that technology has taken over. Okay, there's no guesswork now. There's definitely no guesswork. There were a lot of things that we could not do as a surgeon. Because if you look at the face as such, face is not a vertical, it's not a straight structure. It has a lot of curves, it has a lot of bends. So you need to accordingly start thinking how are you going to reconstruct. Resection was always been a resection, meaning cutting and taking things out, not cutting the tumor part or cutting the whichever part of the anatomical portion that you want. That was always we were excellent with. When it comes to reconstruction, that's where technology support came in big time. It helped us to see where we are, what we can do, how much we need to remove or how much we need to plan, be it trauma, be it humor, be it cosmetic correction, be it a congenital defect that you want to look. It helps us see things much better. It also helped us to augment things better. If I do this, how will the outcome be? If I add this on to this structure, how will my outcome? That's where technology helped. And technology is more visualizing, but the visualization had to come into form, right? That's where 3D printing comes. So whatever you see and visualize on the mouse, on the monitor, you can see that. But if that needs to come to life, it needs to come to a structure. It needs to something that you can touch and feel. That's where additive manufacturing or 3D printing comes, and it's playing a very big role. Across specialties, it is playing a huge role, especially in the region of the head and neck, where I work on, and we are seeing it change patients' lives. We are seeing it change patients' the outcome, their lifestyle, their socioeconomic status, because of the surgeries that you do. How are they able to go forward into the society and lead back to normal lives? So we're seeing it being truly a game changer and a life changer.
Okay, so earlier when we talk about even before 3D printing, maybe 10, 15 years back, or maybe 20 years back, when surgeons had to actually operate on patients, what was the standard practice and how is it drastically changing right now? Because I know you can't have shapes and you can't have anatomy created. Now that we know that with pre-op, with pre-operative surgery, you can plan the surgery well. So. Sure. I'm just trying to understand, what was the state then and now?
No, the surgeries are the same, all right? Now, but what has changed is we're able to do our surgeries much faster. We're able to do our surgeries much accurately and planning. What happens is earlier, the planning used to be very manual. Now, you need to take it from an X-ray or the CT scan, and then it's more on the surgeon's creativity, how creative he is to start visualizing, drawing it on paper, cutting things, and imagining how the anatomy would be and what to plan. And even when he's replacing it, let's say the plates and screws that the surgeon used to have, now we would take, let's say for a surgery involving, let's say a fracture case on the face, we would have an entire armamentarium, no, because there's so much of material that you need to order and keep it, because you are not sure what would fit, what would not fit. All right, on table there is we are prepared for a lot of contingency plans. But when 3D planning came into play, that contingency plans changed into actual work. This is the way it's going to be on the patient's mouth when you open it up. This is what you want to do. So therefore, keep these plates ready or create a plate. The fact that we can even create and custom make a plate to the shape of the defect is what gave 3D printing the edge. So therefore, what happens is you're prepared. It's like going to war with all the necessary armamentarium much early in advance, because you know what you're going to see. The earlier version was we could visualize, we could see, but it was purely the surgeon's skill. And there was a steep learning curve. No, you had to go through step 1, step 2, step 3, step 4 to achieve, to reach a certain standard. Today, with technology, the learning curve is becoming a little bit more shallow. You can straight jump on top.
No, well, the question is also where I wanted to have a clarity was, doctor, that earlier, for example, if you had to create a bend, because now you can print it the way you want to,
yes.
in terms of
yes.
size, as per the implants that you require.
Yeah.
Earlier, there had to be a jaw line that you would probably want to print. Not print, but have it done through a mold, or maybe a mold. I mean, you probably would have to bend it, or challenges have been there. It would have been more like a manual thing that you would have had to do it.
Like I said, there's a lot of work. True, there's a lot of work on the surgeon's hand. So on table they were doing a lot. See, for neurosurgery, for example, they would prepare the bone cement on table and then make it on top. They would adapt a mesh, cut the mesh that they want to keep it, fix it on the cranium, see how it is adjusted. Even for jaw corrective surgeries, a lot of adaptation happens on the theater, on the OT table. So time, there's a lot of time that goes in. There's a lot of here now. Time is a critical factor. Now with the cost also going up for the OT rooms that are there, cost also plays a very big role. Right. So if you save on cost with the timing that you're there in the operation theater, it in turn saves on the patient that they're going to pay. Right. So that's a big factor. Time has become a very critical factor, and accuracy. We have come to a state where we can be 99% accurate. That's where we are to manufacture.
Right. Doctor, I want to know your journey from where you started, being after your PG, in terms of how you took 3D printing as a technology to really see that this could be an opportunity. And I see a lot of passion in you, doctor. So I need to know, I'm sure passion is the driving force. But yeah, once you have really realized and acknowledged that, yes, you got to know that this is where you want to go. So how did it all start, doctor?
Okay, truly, for where I am today, it's truly the grace of God. And I come from a faith, Shubhu, where we believe that God made man out of clay. Understand? So there's a lot of molding that He did. So there's a lot of manipulation, design that He did for man. So that concept stuck very strong in me. And so when we were introduced to, I was introduced to 3D technology more and as a postgraduate in 2005. And as part of my postgraduate thesis, so we were talking about rapid prototyping, and so that time modeling. So which means that we were into modeling, cutting the models, adapting the plate on the model, adjusting on the model. So a lot of this was happening in 2005, 6, and 7 itself. We were there. I mean, I learned. I had the wonderful opportunity of working with some of the great surgeons over this journey over the last almost 8-10 years now, over the last 10 years of working with top surgeons in the country, so who helped me to where I am. Journey has not been easy, Shubhu. There's been few ups, there's been a lot of downs, challenges, because this is an individual. It's just me and my wife as a private limited company that we started, CTARS, and but the family has been a very big driving force for us, and they actually the biggest casualty of all this has been the family. They are the ones who had to take a lot of beating, brunting, and all those things. But through it all, today we managed. We've seen people use technology a lot more. And I, being a surgeon, I started when I finished it. I started working with Rajan Dental Institute with Dr. Gunaseelan. That's why you also learned a lot of technology work. Okay, and then came the fact that we wanted to start something with my friend helped me a lot, Dr. Karthik and me. He said, "Why don't we do something?" And so we worked on starting stars. Once stars started, then there was no turning back. We realized that this is the way things need to be, uh, and then we took it. We had a lot of challenges, a lot of downsides to us when we started because we didn't have any reference points to where as a company. But then the purely the thing that drove us was, like I said, it's purely God's grace and the goodwill of a lot of surgeons. I mean, if I want to name them, there will be a lot of people that you can name, and Dr. Abhay Kamath, Dr. Mustafa, Dr. Pramod, Dr. Manigandan, Dr. Veerababu, Sujoy Mukherjee, a friend of mine from Calcutta, Dr. Johnson Raj. I mean, you can name one. I mean, if I missed out something, it's not intentional. It's just that everybody had actually pitched in because of the fact that we were part of the surgeons community. They pitched in. But where I see now is the adaptation to technology has been more today from where we were when we started 2014, 15. When we started, that time people would be, they look at it, okay, can you guys do it? Because the West was already there. Europe was already doing it, but they were not sure whether we in India could do it because made in India is always a small tag, right? Whether you can do it. The motivation that we had from actually our prime minister was very strong because Make in India was that time 2014 is where they had brought it. No? So that was a big inspiration for me. If we can do it in India, we should do it. No, okay. So why don't we do that and show the world that we can do it? So that was a big inspiration, and so that's where this started. Never gave up. I mean, we had it's been draining a lot financially because these are not parts which are cheap, especially when you want to do a custom made work and if you want to look at softwares that you have. These are extremely expensive things to do. You, for example, when we were nobody, 2000, I think remember 2017 when we came in, Shibu, we were just starting, and then we were just on a couple of cases, no, and then you said, John, I realized that you are doing some good work, and we want to encourage you. So that was a big encouragement. Trinity Media, the award that we got when we were starting was a big encouragement. Then things slowly came in, things started coming in. The acceptance of people started becoming more and more, and also success stories. Today we have done close to over 300 plus implants, Shibu, on an average of almost up to about 5 implants a week. I mean about 15 implants a month we are doing now. That's where we are. Okay, and not just the implants, custom implants. You're talking about guides, you're talking about models, you're talking about. So our scope is becoming bigger. Now we're starting to look at stars dental as such, because you realize dentistry as such, there's a lot of technology based on it. No, so implant guides will come into this, dental aligners will come into this, digital smile design. So my job here is to start thinking what is the next? How do we use technology next? And then you go forward. A lot of support. We had a lot of great people with us, a lot of good doctors who supported us. Even when we made blunders, there were people who encouraged us. I don't know, Dr. Soni Jacob from Kerala has been an extremely good support. Dr. Venkat Chalapati, Madurai. We made blunders. I'll tell you, down the road, we have made a lot of blunders. I've made a lot of mistakes. Some implants have failed. Sometimes the guides have not sat. But the surgeons always came back. You understand? The doctors, they've always been, okay, John, I mean, you're part of us, so let's see how we can rectify this. So a lot of doctors have been very supportive, and so we learned. Now we've almost come to a point where we're hitting the nail bang on. Uh, that's where we are.
Yeah, that's good. I mean, that's where you have that's a beautiful journey, doctor, from where you started, and thanks. It was also a journey where it was where we could also be a part of. Thank you so much for the acknowledgement. But what we see is, and we are very motivated to see, doctor, the way you've actually journeyed through, and now you also becoming a global respondent. Now that you're also setting up businesses globally, so that's a great venture going forward. Can you just elaborate on that too, doctor, in terms of
Okay.
how
Yeah.
you?
Okay. Like again, Shibu, for somebody like us who has absolutely no backup, just the backup, strong backup of prayers and your family just supporting you with whatever they can, and your wife motivating you and pushing you to do much. Um, we are doing okay with India as such. We have a pan India presence. We get work across India. We have a team that works with for the entire spectrum of work that we do. COVID actually proved a breaker for a lot of us. We stopped. I mean, it had to came to a crashing still. But luckily, COVID also came out in phases, which means that there were certain states which were open, certain were closed. So what happens is the states which were open were giving us work, and then we were routing it. When during the process, I do realize that there were companies, manufacturing units across India who needed support. So I said, okay, rather than all the work coming from here, we started designing things, and then we started manufacturing it in Kerala. We started manufacturing in Bangalore, in Delhi. The prototypes were being manufactured there, and they were shipped to the doctor there. So that equation proved very easy. It was business for them, less investment for me, and the doctors got things on time. That I said, if I can do it pan India, why don't I do it globally? Okay. So on that context, again, purely it was God's grace that this came in. We had an opening in Canada, so we started working. There's a company called Crest who started working along with us. This connect came through Dr. U. Chandrasekhar. So a lot of thanks to him, and he's been my mentor throughout this journey. And like every time you hit a roadblock, you call him up and say, "Sir, you see, sir, uh, can you help us out? Or can you sort it out?" And so he's always been a big support to us. And so this came in through, and so we've been pushing along to see what are their strengths. And so the concept, we realized that Canada needs a lot of work. And so accordingly, same like Canada, there's a lot of countries which need a lot of support. Just that we are strong with design. So we said design will be us. And so the collaboration is that. So we started working. Now God willing, we have a company also, the registered company there in Canada to cater to the Canadian community. Then slowly also we're starting to work on the UK, starting to work on the other countries, Middle East also is on the which we want to look at. Where the concept is Shivu, design will be done because we are strong in design. You need to be strong in that, and then collaborate with companies there so that they can set up a manufacturing. So then once travel opens up, we already have a good friends. We have a couple of doctors that we have in the other nationals, and Indians are everywhere in the world today. You understand? So we tie up with them, bring up a concept, we see how this can work together. And my partners in Canada have been very supportive also. Though financially it's been, we're working things out, they've been extremely supportive. And so they, John, this is what Canada needs, so let's push it across. And so we see a need. Shibu, actually speaking, there is a big need. Globally, there is a big need. Let's not look at just major cities. You look at countries like Prague, you just look at countries like Mexico, countries like Argentina. See, that's what you need to start looking at. If technology needs to go to them, we need to take it forward. And how do we take it forward? Is with groups like this.
Right.
You understand? If we collaborate and start working together, and it's like people like you who provide the platform, who provide the know-how, and then we all connect together. That's the way we all. I still say. I mean, I think you would have seen it in a lot of my talks. Even if 100 companies like me come today and start, India has the capacity to accommodate all of them. If India can do it, see globally. Even if 100 people, double my size, want to come across, it is still open. The cake is definitely large for us.
Yeah, doctor. In fact, the other day when I was just going through a research which has been shared by one of the agencies, I found that it's only 0.67% of consumption of 3D printing technology in the country. I'm talking that overall. So you can imagine what would be medical as one sector. So I think the opportunity is huge in terms of looking at that as an option, and also to setting up 3D printing service hubs in the country. That's forward with Atmanirbhar and the Prime Minister's initiative on Atmanirbhar. I think there's a great opportunity, and you're very rightly said so that we need to work as one unit to see how we can take this to the next level in terms of an opportunity, and we being the global hub. And I think that also constitutes to certain areas where we also need to really check is standardization in terms of validation, and and which also reminds me that you've also got some validation and approval done to making things more easy, because now that you are a global company, those are requirements that we need to have. So congratulations, doctor, for all the good work that you've been doing in this space. And there is much more ahead that we would get to know from you going forward. But very, very important is also to give back to the society. What we believe is, as an organization, Trinity Media is always in the space of seeing, how we can educate and train people. So we started with 3D printing world in the years in 2014, 15. We started this, and 3D graphy is a conscious effort for medical and dental, because there's still so much of intricacies that we need in terms of getting to know each specialization, how it can be proliferated with expertise like yours and others who can come and share these. Training and education, doctor, is very, very important because the educational system doesn't have that right now. So how do you think that we should do our bit in terms of getting in that?
There has to be, I firmly believe that there has to be a standard when we do, especially with healthcare, okay? It's just not because of the fact that we are passionate towards it. And again, I'm saying that not that I have answers to all, and it's not that my designs work. I mean, a lot of people are there designing things and they can do much. They obviously are doing a much better job than we are. But where I come at is there has to be a certain standard for the solutions that you offer. Okay. Now that will only come by us having a standardized training program going on. Anybody who wants to start a company, anybody who wants to get into 3D printing has to undergo a proper training program that needs to be. It can be, today training program doesn't have to be like today with technology, you don't have to even come physically, right? It can be an online program. It's something that you guys can think of where we have a set standard program where doctors, engineers, CAD designers, or anybody interested can come in. But also have it for people who want to start up. See, my core is we are supporting a lot of startups with us. And as I told you, I've been by God's grace been selected as one of the senior expert panel for Innovation India. All right, so we want to encourage a lot of startups to start 3D printing, but there has to be a standard in what you start. If you want to get into healthcare, please be very careful in what you do. We encourage you, we want to support you, but please see that there is a certain standard in what you do. Okay, that way we know for sure that everything goes. Business can go on from any part, because there are still a lot of states which are not using 3D printing to a maximum. Orissa, for example, Bihar, Assam, where it needs to, the Northeast and all, I see very little work, but then people are interested. I see there are a lot of intellectuals there in these people who want to use technology, but probably the access to technology is very limited. Okay, that needs to open up. So again, that's where you come into a play where we can probably sit with industry leaders. There are a lot of other companies like Imaginarium offers wonderful services. Incredible 3D Incredible does amazing services. Confident again gives wonderful dental services. So market leaders can all join together. Jalal, I think, also has a good team that works on. Bring together the team leaders, frame a syllabus. Let's work on a syllabus, because I also need people, right? Over a period of time, once you train people, Shibu, if you see there is an ad that's coming up from us that we need doctors to come for digital dentistry planning. So if they are trained in a platform, I can take them for myself also, right? And anybody who wants people, they can straight away take it. So you have a good pool of skilled people. Training is something which we also collaborating with Canada, where we have a wonderful team of academicians who are excellent trainers. So that's something which I think Trinity 3D Graphy is training along, was collaborating with CCC, our Canadian partners, and we can bring training as such so that the best is offered for our people. That's the way I look at it.
Thank you so much, Doctor, for your time and opportunity that we've got to share and understand from you the way you started, and it's really commendable, Doctor, for for what we got to know, the journey, and wishing you all the best, and
thank you very much
for your time, and wishing you great success going forward. Thank you so much, Doctor, for your time.
Thank you, Shibu. All the very best to you too. Thank you.